All right. Well, thanks everybody. It's great to have you here. I'm Brent Malacote, Associate Superintendent at SCOE, and it's always a pleasure to get this thing kicked off. Let's go ahead and go to the next slide. We'll get things rolling here. So here's our strategic plan. I'm not going to spend a bunch of time on this. We reference it every time, but I just like the way that I'm just going to talk about kind of the general outline of this today, that we've got a vision, we've got a mission, and it doesn't stop with a vision and a mission. There are desired outcomes. There are outcomes that I think we're all interested in. As you look at these outcomes around increased capacity, infrastructure and partnerships, expanded access, and collaborative infrastructure, these are the things that we build this community of practice around. So hopefully you all see this because it's definitely top of mind when we're putting together agendas each month. This one's no exception. We've got our theme around building family and community trust continues during our March COP. And really just excited to have the Orange County Department of Ed and Anaheim joining us today just to talk about the strategies that they're using to increase opportunities for billing. They've got some real lessons that I think we can all take note of. Their numbers are very impressive when you look at how they're accessing the fee schedule. So you'll hopefully see in the desired outcomes today, we'll get to see this work in action with Orange County and with Anaheim. So thanks to both of them for joining us today. Let's go ahead and keep it going. Here's our objectives and our agenda for today. You'll see that there's a lot of similarity from meeting to meeting. Our objectives reflect on the work to date, envision next steps to enhance school-linked behavioral health services. I think we're uber focused on the fee schedule. We're uber focused on the Children and Youth Behavioral Health Initiative, but we're thinking about all behavioral health services and how those things get linked. It's that coherence and the way that we're thinking about the connections too. So we want to empower community voices. We want to engage in activities to foster collaboration and learning, provide insight on TA and ways to support administration of the capacity grants. And I think you'll see all four of these really, there's a nice reflection of each of these, I believe, in today's agenda. I hope you'll agree at the end. Our agenda, we have a welcome, peer learning and discussion. Again, thanks to Orange County Department of Ed and Anaheim for their partnership in this. And then we'll close with an intentional closer. As we're talking about the agenda here, we did want to point out, I think it was even something that came up in the input or the feedback after previous communities of practice. We're gonna close about 10 minutes early today, just to support you moving on to your next meeting, whatever you've got next, in a way that feels good and not stressed and rushed. And we just wanted to call that out right now so that you can plan on it. But we'll plan on ending about 10 minutes before our time that we've got scheduled. Housekeeping, I need to follow my own request here, update your name to put your COE along with it. And I think you all saw it, but we're recording this presentation as well. So just something to keep in mind so that you can review it if you want to come back to it. And if somebody's not able to join us today, they'll be able to be there. Although we've got 80 folks today. This is great. Appreciate you all taking the time to be here in March. So let's go ahead and go to the next slide. All right, I'm thrilled to turn this over. I'm going to turn it over to Veronica McClendon. Veronica is here to support our inclusive welcome. I think it's great that we've got people stepping up and stepping out there to do this. And Veronica is gonna be our person to lead the warm welcome today from San Bernardino. So Veronica, let me turn it over to you. And thanks everybody for being here.
Thank you, Brent. Good afternoon. My name is Veronica and I am with SBCSS. I'm going to take us through the inclusive welcome today. I hope you guys enjoy this exercise. It is the rosebud and thorn exercise that promotes self-reflection, positive thinking, and gratitude. So, rose symbolizes something you're grateful for or something that is going well in your life. A bud is something new, something that you're looking forward to, something that's giving you hope, motivation, or thorn is your option, which is something that you're feeling challenged by or causing you a little bit of stress. So we're going to be going into breakout sessions to do this activity together.
Okay, great. So we have one exciting new thing to announce. Here at Capacity Grants, we've started making memos. So we launched our first memo today. And this really builds off of the COP that we had last month from Ventura around strategies for collecting student health insurance information. We took some time to interview Mariposa and Siskiyou as well. So that way we've got some learnings from various different counties. And then the Ventura County is kind of a summation, a little bit of the COP last month. But we really kind of wanted to put this out there as to really help folks kind of have something concrete they can go back to. One of the pieces of feedback that we've gotten from all of you is concrete resources being something that all of you are wanting more of. So we've been thinking a lot about here at Capacity Grants, how can we offer more concrete resources? So we're going to be doing memos, maybe about 2 to 3 per theme. So we have about 2 more underneath this first theme of building family and community trust that we'll be releasing shortly. So look out for those soon. Thanks, Sienna, for putting that in the chat as well. Hope you all check it out and feel free to give us feedback as well. This is a newer endeavor, so we'd love to hear from you to make sure this is meeting the need out there. All right. Next slide, please. Okay, so incredibly excited to have Orange County's Department of Education and Anaheim Elementary School District present today. With prepping for this presentation with them, it's something I think we've been prepping for like 3 or 4 months. And as soon as Mayu reached out to suggest Anaheim, she was incredibly excited about having them present, and because they presented at other spaces as well, and they've done a phenomenal job presenting. They're one of the highest billers in the fee schedule, and they have a really phenomenal structural approach to school-based behavioral health services in their LEA. So we're just so incredibly excited to have them here. Next slide, please. All right, great. So one of the pieces I want to just really highlight that I really loved as I was prepping for this COP today was I really love the way that Anaheim seems to be taking the slower approach of really making sure that they're leaning on the trusted relationships that they have to help them build up the student behavioral health services that they're doing at their school site. So they're really making sure that they're listening to their staff members, their PPS school counselors around some of their concerns around billing for their fee schedule and going slow to make sure that they go far. I'm just so excited for them to present today, and I'm so excited to kind of keep hearing how they continue to do this really important, amazing work out here. So I'm excited to introduce to you Mayu, Kristen, and Shirley today for your presentation. We'll hand it off to you, Mayu.
All right. Thank you so much, Patrick, for all the support and preparation. And I'm going to go ahead and share the slides here. Okay. Hopefully everyone is seeing the slides. Okay, perfect. Well, I'm Mayu Iwatani here at Orange County Department of Ed. And I just want to share that I'm not doing this alone here. I have a whole team now that's supporting, and that's been, they're really amazing and helping. And together they bring different perspectives and experiences, bringing us to this nice balance and looking at all the different roles and providers in this fee schedule. So that's been something that has been super exciting. Okay, I'm going to go to next slide. All right, just to give you a little bit of a snapshot of what Orange County is made of, because, with Orange County, we've been in Laguna Beach and MTV and Orange County Housewives and all these, reality TV shows, but maybe you're not as familiar with what our student group looks like. So we are about 430,000 students enrollment. That has been declining over the years, just as many of our different counties are experiencing. We used to be about at 450. So just, decline. I want to say some recent data I saw about 13% in declining enrollment, which basically means that we are doing more with less money, right? Because the mandates keep on increasing. We're dealing with smaller, with some staff cuts, but the work that we do is just growing and growing. So that's always a challenge. We are made up of 29 school districts. 29th we're counting as our county office, our alternative education program, 651 schools. Of those, we have the charter schools, elementary schools, middle schools, high schools, and other types of like continuation high schools that make up Orange County schools. And then about half are Medi-Cal eligible. This might also surprise folks because I think once again, Orange County has this impression like, you know, socioeconomically, just higher socioeconomic, but there's actually a great mix across the different districts. So one thing I want to highlight with Orange County and our efforts is much like what you're going to hear with Anaheim Elementary, the infrastructure didn't pop up overnight. And we are very lucky that our different grants worked out the way they did. As the first grant we got that really impacted our ability to come together and develop relationships and partnerships was our MHSSA, which is now the BHSSA grant. And we wrote this grant in collaboration with our district. So we actually had multiple information and grant discussion meetings prior to writing the grant. So we heard from our leaders in the districts, assistant soup, some mental health leads, some superintendents came together and said, what do we want to write this grant to? So it really was a collaborative effort. And at that time, we were seeing the need for some technical assistance around mental health supports and programming. And so we came up in partnership with our healthcare agency, a model with regional mental health coordinators that were divided across the county and worked with specific districts with the feeder pattern. So the elementary school and the high school districts were clumped together in the general region. And the idea was that these regional mental health coordinators will be their go-to folks, kind of a lot like what DHCS is doing with their reps. You know, they're divided across the state and providing regional support. So it's very similar to that in Orange County. Through the Regional Mental Health Coordinator Program, we developed a quarterly network meeting. We provided trainings. Actually, from that came our mental health summit to support the site level school-based mental health professionals to have that one day of in-depth training, PD, and connection, because that's not an opportunity that traditionally in schools, like even school counselors, school social workers, psychologists, they all get to come together. So we created that opportunity, and that actually came from the regional mental health coordinators. They talked to the mental health leads, and they constantly were getting feedback on what do you need, what would be helpful, and they would bring that and turn it into ways of how to support the district. So that was one of the ideas that came from the regional mental health coordinators. And so what we did, and we had a regional mental health coordinator colleague that said it was like Burger King, have it your way. So like whatever they needed, when they needed it, how, if you need a 30-minute trauma-informed practice training, fine, 30 minutes. Like if you need that to be like whatever day, and then you need it 5 times repeated, okay, perfect. So we really, our team was really good at catering those services. So that really developed the trust and the foundation for the partnership across Orange County. And then January, as all of us, I think most of us participated, the SBHIP, Student Behavioral Health Incentive Program opportunity came up. And once again, I think we're really lucky at Orange County that we are basically a single plan MCP with CalOptima. Kaiser has a very small percentage, but they came on after SBHIP was launched. So they were great partners in just supporting what we were doing. But having one MCP versus like 3, 4, like some other counties do, made it very easy to work closely together. And also one of the unique things Orange County decided to do is to work with all 29 districts. So based on the number of district student enrollment, I remember CalOptima saying, we only need to partner with 3 of your districts. And because we're also a large county with a large population of Medi-Cal eligible members, we had a decent amount of funding that came with that. And we're like, okay, no, the BHSSA grant was $7 million and we worked with everybody. So with the dollar amount that SBHIP was coming, there's no way we could rationalize only working with 3 of our districts. So we went the 29 district route. And this was also done in collaboration with the superintendents and leadership of the districts, hearing from them what are the targeted interventions that you feel are a priority. So really getting that buy-in from the beginning. And so through that SBHIP, we are providing countywide access to Hazel Health, which many of you have now heard because they're one of the state affiliated providers. They funded 10 student wellness centers that we call Well Spaces in Orange County, and then continue to provide mental health trainings. And then in addition to that, we had dollar amounts allocated to each district based on enrollment numbers, so that each district felt empowered to determine how they can meet those targeted interventions for what their district needs in their community. So that brought in the second phase where we are now on cell phone basis with the MCP, like our lead there. And I'm not joking when we're on calls at like in the evenings when we need to. So we have that relationship where I've got you, you got me. We'll collaborate. And now we're looking at that second phase of how do we continue this partnership and how do we support LEAs with the fee schedule. So we're trying to like figure out that next level of partnership in for the success of all of the services that the schools are providing. And then finally, the capacity grant, which we all are aware of, we have 45 LEAs that are participating. So all 29 districts were in, and then 16 charter schools. So this is kind of what it looks like for us right now. We have 36 LEAs that are participating in the different cohorts, and cohort 6 just was announced. So and that represents 27 out of the 29. So basically, we've got almost all of our districts in a cohort and then charter schools. Of those LEAs, I believe the last I checked, we have 4 LEAs who have successfully submitted their some kind of claim and receive reimbursement. And one of those LEAs are in cohort 4. So we're really proud to say that that window is shrinking of the start to finish, and we're seeing that success. And obviously we have Anaheim Elementary here. We always highlight how they are the lead in the state in submitting claims. And I want to just really emphasize, when you hear them, you'll hear how much work was put in prior. So Anaheim has always been a leader in mental health services and infrastructure and programming. And they not only have they been so successful in developing that structure, they are, and I'm just going to say this, and I'm not saying they're not paying me to say this, they are so kind and so compassionate. And you'll hear that. And I always joke, elementary school district people have a different voice. I think it's a requirement when they get hired, because I have a middle school, high school voice. You can tell, very East Coast, very, and elementary school districts have the kindest, and that's the voice we get to hear and support and through this fee schedule. And what I love about them being in cohort 1, because we only have Anaheim Elementary as cohort 1, is the messaging has always been hope and encouragement. So through the difficult stages of the fee schedule implementation, they have consistently encouraged our other mental health leaders in our districts. I know this is hard, but this is worth it. I know this is a lot of work. So they didn't sugarcoat it. They were very realistic, but they also provided not only their support and help, but also encouragement throughout it. And so that has been the most amazing piece of their messaging. And I know I'll end here just showing that different ways that we've provided support. So I kind of mentioned it earlier, but also we have some resources and tools that you're welcome to click on. I think, Patrick, you're sharing the slides later. So you can see samples of what we've been creating for our LEAs. And if there's anything you have questions on or need some kind of editing, copying, whatever you need, please reach out to me. And I just wanted to show here a list of some of the trainings that we provide as part of through MHSSA, through the capacity grant, all the different funding, but we are continuing to provide trainings to help build that operational readiness for our LEAs. So kind of where we started, and then coming to the partnership we have, and I want to turn it over to our wonderful Anaheim Elementary team.
Hi, thank you so much. I'm going to get the slides set up. I am sitting next to Shirley. I'm Kristen. Shirley Diaz is next to me. Let's see, am I sharing the right thing? I am. We are going to present. We're going to take you through a quick trip of the highlights related to this. Shirley and I can be extensive talkers, so I am literally having a timer on to try to keep us on track, because I know a huge piece of it is questions and answers. So I want to make sure you have opportunities to do that. So with that, Shirley Diaz, take it over, and I'll be your slide.
Sure. First and foremost, thank you for having us. It's an honor to be here. We haven't done anything different than what you guys have been doing for students. We do what we need to do in order to support them, and that's really our journey. That's where we start. So as you can see the graph, and I apologize, I was looking at the years right now, and I'm like, wait, my graph doesn't align. The very last data point that you have is this current year. But what you can see is that when we started collecting data for threat and risk assessments, we started with 100 and then 140, then 270, and then COVID happened.
Yeah.
And then from there, we've been staying there. So that takes us then to where we are right now, right? So that takes us to what is the reason as to why we have been successful. And in reality, I don't know how you measure success. I don't think that we are that successful, but I know that we work really hard. So some of the foundation that we had is that MTSS. It was the system that we had already created back since 2012 when we introduced a counselor per site. And it wasn't just about being uh, reactive to difficulties at school, but it was being proactive. So they were doing DIS counseling, but they were also providing support for all students. Then it came the partnerships. And Mayu, thank you. You are 100% correct. Right in 2020, you guys came when we needed you the most, 2023, and that SB HIP. That's how we begin to build that capacity, right? Having the clinicians come on board. We already had the PPS on point, school counselors, school psychologists, behavior interventionists already embedded in the schools. And then after that, we had, and how do we integrate the system? So that's going to take us to our MTSS framework. And that's basically what we have. So right now, this is what we created. What we did is coming from the school lens. We said, how do we marry the same level of intervention, the same structure that we have for the academic? How do we replicate that for behavior and social emotional? So when we went ahead and we hire our clinicians, we embedded them within. So our wellness coaches, they live somewhere between tier 1 and tier 2. Our clinicians are somewhere between tier 2 and tier 3. So it's the 1.5 and 2.5. And on the left side, you can see what our community support teams look like. So per site, this is the capacity that we've had. And we've had these teams since 2023 already. So it's nothing new that we built. But all of this, Mayu, you are correct, was built with all of the different grants that we apply for. Thank you so much. Like there's a number of grants, right, that were provided to us. So then for us, it was important to welcome our partners, but there had to be a shift in what is educational mindset, what is the clinical mindset. And so when CYBHI came, I said, yes, this is what we needed, because we knew that our dollars were going to take us till the end of this school year to fund the clinicians. So that was our eagerness and ability to say, we'll jump into cohort 1. What are some of the things that we needed to do to understand, and what is the learning that has come out? CYBHI provide us that platform where you really create that ecosystem that they want, where you bring the educational, you bring the preventative, and you are going to bring the clinical, but it is not clinical outside of the school district. It is clinical within the school, is the school-based mentality. So what are some of the things that we're doing? For academic, we create action plans. For behavior, we create behavior action plans. What is the partnership looking like for the clinical? How do we collaborate with one another? So there are things that we are learning from the clinical directors, from our providers, our clinicians that we work with, and they are also learning from us. So we need to document, we need to take data on progress, and they are teaching us, wait, your behavior action plan looks very academic, but what we do is not academic. Where do we find the intersection? And that intersection is truly CYBHI. So what does that look like then? Our partnership. I know there were some questions. How were we able to do some of the back billing, which is how we were able to submit the claims for last year? What we created and what the grants that Mayu and her team and also the partnership with CalOptima and other agencies. What that did for us, or the way that what we did, is we embedded all of those supports within MTSS. And then from MTSS, we develop contracts with outside agencies, but we say, wait, we want a school-based mental health perspective. We don't want a clinical, we want school-based. So school-based is going to look a little different. Clinicians don't necessarily stay in their offices. They are embedded with the schools. They are where the schools, where the students are seeing them, where the parents also can develop relationships. Anaheim is a little bit north in Orange County, so our population may look just a little bit different. I think that we have about 86% of our students on free and reduced lunch. So we needed to bring programs that would eliminate the barriers. And I think that that was the focus of embedding those services, is how do we eliminate the barriers? Parents that don't have transportation, but you need to take your child to therapy. If they are not going to take them, what we said is, if the mountain is not moving, we are going to move the mountain. And that's exactly what we decided to do. We were able to do the back billing because all of our clinical staff is provided by Villages of California, and they have clinical supervisors. So we don't have to do that clinical supervising. They make sure that the clinical notes are approved, revised for medical necessity before they get entered into our EHR, TAD Health. So we don't have to do any of that. They maintain clear records, and then they share that with us. That's how we were able to do that. This year, we have Western Youth Services, as we have onboarded our certified.
Villages.
Oh,
We have
so
both.
we have both, yeah. Villages continues to provide the clinicians. Western Youth Services is providing the wellness coaches. So that's how we do. We have to do any certification for those two? No, the agencies that we contract, they are doing that. So that's how we're able to move forward and moving with the ecosystem, right? So then I know a big question that has come up is, how are you recognizing medical necessity? And first and foremost, I've been reading a lot. What does CYBHI means by medical necessity? Once again, I am interpreting from a school-based model. And the way that we do it is we start with a screener. So since 2015, we introduced a screener to all of our students. It's taken 3 times a year, September, December, and April. And that's how we identified where the students are. We're looking at 2 areas, internalizers and externalizers. And then from there, based on what the data looks like, we go to the referral and triage. Once a week, our teams meet and they begin to see what's needed based on the referral, based on the need. Then we assign somebody to do the needs assessment. Based on the needs assessment, then either a behavior action plan or a treatment plan is created. And then that's when we provide services in case management. So screening alone is not enough for medical necessity. You need all of that data, and you also need that lens from a multidisciplinary team when you are having those meetings.
We're at 20 minutes.
We are at 20 minutes, so I'm going to try to go really quickly. How do we build family and community trust? When we created our clinicians, we embedded 23 school-based clinicians. They are here 30 minutes before the beginning of the school day. And our community-based, they start at 9:30 because we have students at some schools from 6 a.m. to 6 p.m. And so clinicians not only offer counseling throughout the day, they can also offer therapy, but they can do intense therapy for some schools for some students after school, and they can also embed a family component or counseling for the parent. So that is something that we have created. With that and providing support for parents, we recognize the need for increasing that awareness of what is mental health, what is therapy. So for the last 2 years, this year will be the 3rd year, we have been hosting a mental health fair, and it's a resource fair to really destigmatize what is mental health, what is therapy. And also we have parent workshops talking about mental health. It's been pretty popular with some of our parents. We have done some mindfulness yoga with parents, and it was beautiful to see some parents being really reluctant to join, and at the end saying, "Boy, that felt really good." But more importantly, we can provide out of all of the therapy, But if the basic needs are not being met within the community, I am not addressing some of those dire needs, right? So within the community outreach, we do at school, every team can provide the boutique or community closets. We also have the food pantry once a month. We used to do it twice a month at every school. And then from the district, we have a big fair where we do food distribution during Thanksgiving because the students are out of school. So we need to make sure the families have access to food during that week. And we also do turkeys giveaway. And during Christmas, we do food, we do clothing and toys. So that is how we are expanding the outreach and building trust with our community. We're not just here to do therapy, we are here to service the whole child.
22 minutes. You're good.
22 minutes, all right. Am I going? So we're gonna end with this. Last year, out of all the services that we provided, we were only able to have 25% reimbursement because only 25% of all the claims were clean, meaning we had consent to bill and we have insurance information. What is one of the biggest barriers that we continue to face is the insurance. Being in Northern Orange County is difficult for parents to trust and to give us insurance, especially right now. There is a lot happening around us, and we completely understand, which is why we need to have the services in place. However, our emphasis and the roadblocks that we are facing, that would be the insurance. But we rather think of the sustainability of the services as opposed to focusing on the revenue and the claims. I like to focus, and I told the providers, every opportunity that you have to enter a claim, that is an opportunity that you have a direct connection with the human that needed your help. And that is what we are going to focus on and continue to move forward. How am I doing in time?
Great. You're at 24 minutes and that's it. We have lots of time for questions.
All right, great. I tend to talk a lot, so thank you, Kristen.
That was a struggle. For those of you who've never heard Shirley talk, that was brief. That was efficient. Okay, I'm gonna stop presenting. Okay, I think I stopped. There we go. Right?
Yeah.
Thank you so much, Kristen, Shirley, and Mayu for walking us through the playbook of activities and strategies you've employed to, not just collect the necessary information, but also to build that lasting trust with the families and community. And I was particularly interested in how you've addressed the needs of the whole child through the program that you've developed. That was such a great presentation. And I would also like to thank our DHCS and Carillon partners for joining us today. And this is your friendly cue to hop off before we go into our peer learning breakout rooms. So we're about to move into a much needed break, but before we do so, I wanted to provide folks with a bit of framing on our peer learning breakout rooms. I always look forward to the peer learning section of the COP because it allows us to come together to discuss the successes and the challenges we're finding within the school-based behavioral health work we're all doing. I also wanted to point out that while the capacity grants team, can't directly provide guidance about a particular topic, we're more than happy to share resources and best practices that we've gathered in the field. Also wanted to remind the community about something that we started in early this year, and we are continuing in this month's COP, which is splitting up the breakout rooms so you get the opportunity to dig into 2 separate topics if you'd like. There's also the option of staying in the same room if that is what you want to do. This comes directly out of feedback that we've received from all of you around what would be most supportive. One thing to remember is you will not come back to the main room after you're done with your first breakout room. Instead, you'll have about 3 minutes to choose to either stay in your current breakout room or move to another breakout room if you want to. Each breakout session will be 20 minutes long. However, during the second breakout session, you'll have an additional 5 minutes at the end to fill out the feedback form. That's something new that we're doing this month. And during your break, you will have the breakout room discussion areas listed, so you can continue to think about which breakout room you may want to join. Okay, so with that, we will now have our break. Welcome back. I'm gonna wait for more folks to turn their cameras on. We hope you enjoyed your break, and we are now in the peer learning discussion portion of our community of practice. So to briefly review, our breakout rooms are the main room, where you'll have the opportunity to go into a Q&A with our presenters today. We also have our ORP room. Another room is LEA supports, and we will be focusing on gathering student health insurance information for this month. We also have the Tier 1 fee schedule room, another room reserved for our small and rural COEs. We have a documentation breakout room, a workforce breakout room, which will focus on certified wellness coaches and expanded learning. And if you need a one-to-one room, just let us know, and we will have you connect with another COE in that smaller space. Just as a reminder, we are splitting up the breakout rooms so folks can get the opportunity to dig into 2 separate topics if you'd like, or you can always choose to stay in the same room the whole time. You will not come back to the main room after you're done with your first breakout room. Instead, you'll have about 3 minutes to either stay in the breakout room or you'll move to another breakout room. We'll give you a cue when it's time to do that. And each session will be about 20 minutes long. Each breakout room will have a facilitator to guide and document the discussion. And following today's meeting, a summary of the breakout room discussions will be posted in the Capacity Grants website to support continued peer learning and also networking. When we come back, we will ask each room to share out using the Zoom chat. So as you discuss, consider if there's a nugget of learning or something that stands out to you that you would like to share with a larger group. And we will ask you to do that by dropping your thoughts in the main room chat. Also, during the last 5 minutes of your room, your breakout room facilitator will ask you to fill out the feedback form for the COP. As a reminder, the Q&A will remain in the main room and will start in about 2 minutes as soon as we're able to get everyone situated in their breakout rooms. So in a moment, the rooms will open, and the rooms are self-select. So go ahead and select the room that you are most interested in. If you're having any kind of trouble accessing your assigned room or the room of your choice, please remain in the main room for assistance, and we'll surely help you. And with that, we will now launch into the breakout rooms, and I hope you enjoy your conversations.
All right, looks like we got a great group. Wonderful. Well, oh my gosh, it's such an amazing presentation, Orange County. Thank you, Mayu and Shirley and Kristen. It's really been a pleasure to kind of hear your history and the genesis and the story to bring you forward until today and seeing how it all comes together. So holding space, this is our community's questions and answers. So folks, if there's a question you'd like to ask, feel free to go ahead and either raise your hand or come off mute or put it in the chat, and we can go from there.
So just first off, thank you so much for sharing kind of how I really appreciated what I really appreciated about your presentation was, how you did the overarching like plan and how it fit and aligned in your MTSS structure, which I think is really helpful for each county or LEA to figure out. So what I'm just curious about is how, and it sounds like you have quite a robust team, like how did you go about kind of differentiating who does what or who is in what lane? So if you can maybe share a little bit about that.
We had so many different conversations, visuals, through the years, right? Because at the very first time that we created the team and we had the PPS counselors with the community mental health licensed staff or in the process of becoming licensed, There was a lot of discussion. There were a lot of barriers related to, I think my personal opinion, fears, right? About, well, why do they need you if I'm
Yeah.
here and vice
Yes.
versa? But I think ultimately the message we just kept giving over and over is there's more than enough work for everyone. And together we make a really well-rounded, robust team. And it's not about a turf war, it's about doing what's best for kids. And so I would say that if I were to find and pull up that very first, when we started the teams back in like 13, 14, 15, that very first visual probably looks very different than what it would look like now. But I think many of the barriers we had have been removed over time, especially we have a pretty stable group of PPS counselors. And so about 12 out of our 23 have been here since the beginning of the teams. And so,
2012.
yeah, I think they understand it in a way and they're more confident and comfortable and understand their role. And they've also evolved as well. And they've learned how to work together and recognize when there's overlap and be comfortable with it, but also recognize the different strengths you have, because you can make a visual of who does what, but the reality is when you have the people in the position, there's going to be some flex. And so figuring out how to have that conversation, but also giving them the opportunity to flex a little bit is a very fine line. And you learn which teams need the absolute, no, you do this, and which are the ones that can kind of figure it out on their own and really operate as a functional unit on behalf of kids.
And I think that what also helped is that our counselors started as CIS counselors
Yes.
working with IEP teams. So being part of the multidisciplinary team wasn't new to them. And then we expanded their role as being more preventative as opposed to just being reactive because of that. So that I think was really easy for us to move from one, because they understand that the value of having different voices in a team in support of the student, and everybody brings their own lens.
Because it came in that day. Yeah, I
Yes.
mean, we didn't have any
No.
school counselors in the district until 2012, when AB 3632 shifted the
Yes.
mental health funding back to schools. And so at the time we hired one school counselor, and we went within the span of, I want to say, I was in Shirley's position then when we opened those programs. We went from like 1, 3, 5, 12, 24, and then we closed one of our schools through the years and became a charter school. So we expanded pretty quickly. But yeah, they started in special ed. So they've had an understanding of that team mindset, and also a lot of the similar beliefs that are now setting us up for success with CYBHI as well, versus maybe coming from a traditional school counselor mindset.
And also having a lot of conversations of what is school-based mental health. Because we're not talking about mental health, we're not talking about diagnosis, right? We're talking about school-based mental health. What is that? That I think was really positive that we started that conversation early.
Yeah.
Thank you both so much.
Oh, that's great. And with that clarifying question, I might have missed it in your presentation, but you're working with community-based organizations. Are they providing some of your mental health staff that collaborate with them with your PPS credentials that you have within your site? Is that correct?
Yep, exactly. The only rule we have really is, well, not the only rule, that's an overgeneralization, but is that our community partners do not provide any services that are on IEPs, which for CYBHI, that's in a separate lane anyway. But the contracted mental health staff we have are working with all the students at schools, but not providing services on IEPs.
So the clinicians provide therapy if they need to, school-based during the day, therapy in the after schools because they work 8 hours. They also do a lot of the case management and psychoeducational, and they help with the risk assessments or threat assessments throughout the day. So they are not just here identifying who needs support and then linking that with an outside. We wanted to bring those supports within. So there is a weekly meeting, and then they go about what's going on and what is the outcome of those referrals. So we know whether something is working or not.
Another thing related to that that I think probably didn't come through clearly in the presentation, because we were focused on, you can tell we're talkers now that we get some Q&As. I was literally keeping her on time.
It's all good. We love it.
Very nervous in our planning session, but is that we do have 2 additional clinical counselors
Mhm.
that are district-wide, and we really use those in a wraparound type model. So when the school site team is really struggling in meeting the needs of a child or encountering some barriers with families, pulling in one of those specialists as well to really help build that bridge with home and figure out how to get the family involved so that we have a different experience with the child at school, and we're really addressing that entire family. So that's like an additional layer in the community piece of it.
And that also goes with the needs assessment, developing that what do you need? And it's what do you need from us, like from a mental health perspective, behavioral support, but then also they help us to identify things more like I don't have anywhere to go tonight and I have 3 kids,
Yeah.
or I need to go wash my laundry and I have no money, or if our students get hospitalized but the parents don't have transportation.
Yeah.
So that's how we are using those 2 people as a wraparound and leveraging some of those funds to be able to support the whole child.
Great. Wonderful. Thank you. Amanda, you got a question for our partners?
Yeah, and it may have already been answered a little bit, so I apologize if it's a little bit redundant, but I was hoping you could speak more to like what does it look like on the ground for you blending that educational mindset and the clinical mindset with your staff, right, for those school-based services? And I guess like what does that look like on the ground and how did that training look? And do you have examples of maybe what that could look like?
Yeah, we've had I think that the first component is partnering with the right agency that believes in what is school-based mental health. We've had other partners that came with a very clinical mindset. So they came, they provided services, but they would never exchange any information about what was being done with students. And I said, I don't want details. I don't want details of the treatment plan, but tell me overall, what are you working on? Is this working, right? So developing that partnership from the very beginning is key, because when we developed those MOUs for our clinicians, we said we want a clinical-based model. So we don't want our clinicians to be sitting in their office and the students come and they see them and they go. I need them developing relationships with the students, with the parents in the beginning, be embedded within lunch and recess, and then, provide that type of services. So that was key in developing that. And I think that helping them understand what we needed was key, and helping our PPS understand where do they come and how do you differentiate who needs school-based services, right? Who's going to be maybe like in a group based on the BESI data and based on when you have been a referral comes, identifying who is going to be the best one to support. I think that becomes key.
And I think, and if I heard part of your question accurately, Amanda, when you asked for an example, I'm thinking back to when we started rolling out TAD Health, right? And writing the claims and putting information in. There was a learning process even though we had staff that were used to working in a team and understood each other's roles, our school counselors needed to learn how to talk about what they did and how it fit into that model in submitting a claim. And so there were a lot of conversations about, how do you look at your daily work and what you're doing to support students, and how does that translate into a claim? There was a little bit of a steeper learning curve for them because they just weren't used to thinking in that mindset. Our clinical partners, right, they are more used to thinking that way. They needed help understanding how they take their skills and integrate them in a school setting that may look different from a one-to-one therapy room, separate from what's happening at school. So I don't know if you want to give a specific example of there were so many common examples I'm thinking especially with the school counselors, the PPS.
Yes. And in all honesty, the way that we want to center the intervention that we provide, we center it through the screeners. So then you get that aggregated data at the end of a mid-September, and it has like a multidisciplinary team discussion where you begin to see. So that is from the clinical lens, that's what they learn from us, right? Wait, what do you mean you do a screening for everybody? And then we begin to see, okay, is it a
classroom tier 1 issue?
Correct. Is it a classroom need? Is it a grade level? Is it a classroom? Wait, is a small group? And even if we provide that intervention and that student continues to need support, then that's when then they can use the partnership and say, no, now I need either do individual or they have to see the clinician. Or wait a second, even when we put all of this in place, we need to embed the parent. So it is working together, and it is creating those cohesive teams. At the 23 schools, the teams that are the most cohesive and they understand each other roles, you see beautiful things happening with kids. Beautiful things that you're like, my goodness, this is why we do what we do. Is it perfect in every single school? No, but we continue to push on.
We continue to evolve.
Yes, absolutely.
Did that answer your question, Amanda?
Yes and no.
It makes sense. I think what I'm looking for too is like, I guess like maybe too is how were those conversations and teachings like facilitated with your staff? Were they trainings that you sat down with them all together? Was it more of like individual relationships? Like what, right? Because I think I'm thinking of like as a COE, we're starting with talking about like superintendents, and then we're talking with principals, right? And there's this kind of like, there's different avenues we can go. And so I guess I'm thinking with the providers, how are we getting them to be cohesive other than, hey, here's a team, you're going to do this? Like, what are those conversations maybe sounding like to them?
So it was a variety of approaches, right? So one is know your staff, know your groups, anticipate where the barriers are so that when you go into those group conversations, I would first then, if you know you have groups that have strong opinions or they have common barriers, right? So we had the training done in the school counselors, the PPS, then we did training with the partners in separate groups, but there were also at the same time group trainings. The group trainings were more focused on the school-based model, MTSS, and how do we fit together as a team. But when it came to the actual claim and the thinking about your work and that whole process, we did it in the job alike groups because they had very common questions with each other. And so we figured that was the safest place for them. Some of them had some concerns, right? Especially the PPS school counselors. We also worked closely with our association, so they understood. I did a lot of front loading with the association, so they knew what this was about, why we were doing it, the purpose, the sustainability was a huge factor in it. As we hit leaner times, this is an avenue towards continuing the jobs that we have that, oh, by the way, do really good things for kids and families, but knowing the messages that are going to help reduce the barriers in the different groups. So it really was a combination. So I think from your COE perspective, if you zoom back out, because you have that more overarching view, depending on the specifics of your county, what are the different common barriers? Are there groups that really do need an individualized job alike training? And then what are the opportunities to do it together in a more integrated manner? But I think that's really an individualized thought process based on the barriers that you anticipate in your system. What would you add?
Yes, and I think that Kristen, you took it a personal approach with the union because you have a good relationship with the union. Coming from special ed, the union is not unfamiliar with us. So Kristen took a very personal approach with regards to front loading and having those conversations. Our counselors were already submitting claims through LEA Bob. So we didn't have to per se as address that with the union when they started submitting claims for CYBHI, because it's something that they understood from the beginning. That's how we were able to go from 1 to 3 to 6 to 12 to 23. So they understand the need for generating that. So we didn't have to approach them for CYBHI. But Kristen did it on a personal level, saying, hey, FYI, we have good news. We have found other sources of revenue to create that sustainability even more solid than what it was. So we didn't have to do that. Other districts had to do that.
Oh, that's great. And I would imagine like a framework, right? I think when I'm hearing you too, Amanda, asking like a development of a framework that you would be able to provide your districts in terms of kind of not as a schedule, but a framework on how to approach those conversations and how to approach the role and the relationship. That's kind of what I'm hearing you ask also, Amanda, in terms of like a student study team framework or an IEP framework. How do you have a collaborative model between practitioners and PPS credentials that's very clear so people know what their lane is? And maybe that's something that you can further elaborate on, and or maybe just Amanda, I think is what I hear you kind of grappling with. Is that right?
Yeah, more to grapple with. No, that was helpful. And like I said, it's aligned with some goals. I think I was just looking, like I said, to see kind of again what that looks like. And again, because there's always so many challenges and anticipating that there's going to be that pushback. And so just being curious of how especially for those in the schools, right? What was helpful in receiving that amount of information and those pieces, I think is helpful. Right? Because it's kind of like, oh, here's another thing we have to write. And so we have to get them on board and incentivize that. And so yeah, and I think, like I said, just grappling with that and seeing like what was most beneficial in the approach from wherever it came from for you and getting everybody on board. And I think, yeah, you answered most of it and gave me something more to think about.
I think one thing you just said reminded me that it was very conscious planning about not making it feel like yet another thing. It was very much framing the message, and you're already doing it. This is just a slightly different way to think about it and changing your documentation, but it's not another new, like it's not a different new thing that you're taking on. That was also a very intentional part of it, specifically with our PPS school counselors.
And I think that's something that Mayu stated. We both are from special education. Kristen serves as 2 directors. I am a program specialist for special education, and yet we have that relationship with people services because CYBHI is preventative. Yeah. CYBHI is non-IEP related, but we are highly invested in making sure that that support is there for students who need it. But we want to prevent, right? We want to make sure that we address that before it becomes a disability, because sometimes it is not.
And
we
it
just
doesn't
need
to be.
There you go. It doesn't need
Now
to
with
be.
CYBHI,
Yeah.
you don't have to identify with a disability and get an IEP and get into special ed to get the magic land of intervention. I mean, the whole point would be to try to provide it before we get to that level.
And I think
real quick, sorry, just interject real quickly, is a reminder, if you would like to switch to another group or you're just coming in, we're in questions and answers right now. We just did refresh the smoothie bar, so please help yourself to a virtual smoothie in between.
I can use a smoothie.
We want to make sure everyone gets a chance to a virtual smoothie. Hopefully Shannon got one on her way out to the next group. But all joking aside, if you'd like to be in another group, please go ahead, help yourself. If you're just coming in, we're going to go ahead and pick up. Jumping into the next question, Jeff has been so patient holding his hand up, but we'll go ahead and jump in with a new question as we just jump right back in. All right, Jeff, off to you, sir.
Hey, team. And it's great to see Mayu is on deck as well. Looking forward to seeing you next week as we continue to try to think about how to integrate expanded learning into this. And so that's where I wanted to pick up with our speakers. There are a couple things that I noticed, right? And it really says a lot about your mindset. And I really want to appreciate that, right? Because this is about integrated whole child approaches, right? This is not about silos or funding sources. It's about how we all work together to get a thing done that's a need in our community, whether that be school-based mental health, community schools, MTSS, expanded learning. And I'm really seeing how you all are seeing the integrated whole there, and appreciating, right, that in that integrated whole, expanded learning is a part of it. That is not true of every geography. And so just appreciating your mindset and perspective that was clear. And I'm curious just to dig a little bit deeper. I'm wondering if you could describe your partnership with expanded learning. And one of the things that was just so beautiful, by the way, was that you're like, school's open 6 to 6, right? That it's just like, it's just part of what we do, right? And so describe that partnership. I'd love to know a little bit more of the context. Back in the day, I remember, right, Anaheim Achieves and YMCA. And so I'm thinking you may also have a community-based expanded learning partnership in place, but also just maybe describe what that looks like, but also just how it's been beneficial as you advance this whole child approach to integrate the expanded learning program.
I think that's actually, I think we were one of the first early adopters of the ELAP funding as well, if I remember correctly, in the state. And so we jumped right on board that. And I was going to say, I think that's one of the only positive things out of COVID, to be honest, is that really forced the issue for us, is all of a sudden we jumped into that ELAP funding. We were grappling with what that looked like. And then when we came back to in-person instruction, remember, I hope someday we never have to reference in-person instruction, but When we came back, it really came back also with the mindset of, oh, we're back. And by the way, we're here for a much longer period of time because we are now a hub for so many different things for our families, from food delivery, all kinds of things. We used to have the Anaheim Achieves contract, right, for the after school program. You referenced that. We do now run it ourselves, and we no longer have an outside contract. So all of our ELOP, there's a department, right, that is separate, but we do a lot of integrated work. And so our ELOP department, they actually have a different name now, Anaheim Elementary Succeeds with an exclamation point. There's a variety of different partnerships that are contracted staff through there to run all the different kinds of activities, right, that are happening there. But then also our community schools, we're community schools as well. I think all of ours, except for one, have community school funding too.
Two do not have it.
But that mindset is present at all of them. So integrating it, right? We have the staff that are there, and so it's really at the bell at the end of the day, like the services and support don't stop. They're there until the end of the funding, like not the end of the funding, the end of the full day, which is very long for some of our kids, right? But I do think we continue to get creative in the different kinds of variety of activities and programs that we offer. And so while the staff, like our clinical staff from our partners, are available and can do a variety of things, it's very interesting to see some of the programs that some of them are coming up and offering the different school sites. And when I hear some of those creative ideas, I'm always like, how did you like spread that, talk with your friends? Because you do see some of the individual creative options developing at different campuses. And honestly, it's in response to what the parents need. So really some of the parenting groups that have evolved and are happening during that time period, because then the parents don't have to worry about childcare because the kids are already there. So if you're coming to pick your kids up at 5, maybe instead let the kids stay, continuing their activities till 6. But now we have a group of parents we can really sit down and do some parenting work with. We can really take advantage of those opportunities. And some of the schools and some of the staff have some really great ideas.
Yeah, they are using some curriculum-based intervention for developing relationships between parents and students. And you separate the group. Parents go to their classes, students go to their class. Then you bring them together for an activity that they are going to work together. So whatever skills they learn, now you're going to practice it and hopefully generalize it. So when you go home, that is the point, right? In straightening those relationships at home. And we make sure that when so the beauty is that we have been working and developing the system together. So when we became community schools, the question was asked, can we bring a clinician to help us in the after school? And not the after school, but that after hours, or that really lens from that community being more of linking the parents. And so we just brought another clinician, but we embedded, so what are you going to do? So that clinician is supporting more the parent, facilitating linkage in the parent. If you need to go to an appointment, can I help you? Can I go with you? So that is kind of how we are putting both of those together.
That's
One of
great.
the barriers that we encountered is, so we have 3 different start times in our district: 7:30, 8:10, and 8:50, right? Really for transportation, to allow the bus to have enough buses to get kids where they need to go. But so one of the barriers we have encountered is some of the adults would like to do those ELOP group things before school, but that's when you have the conversations like, well, most parents are not really up for a parenting group at 7 a.m. or at 6 a.m. when they're dropping their kids off. So really having an understanding of that blending of the adult preferences with the availability of families.
Well, that's great. I know that Heather asked a great question. I'm going to pause real quick. Mayu, I know you have your hand raised, but I know that Heather was asking a question about delivery of services in classrooms that you're billing for. So I just really want to lift that up because I know that's been a hot topic for other people as well. So Heather, did I get your question right? Perfect.
Okay,
Thank you, David.
When you are doing the screeners and you are identifying and you see that 16 students out of 24, 17 students out of 24 are being referred either for externalizing behaviors, aggression, defiance, disrespectful, or internalizing, and you see such big groups, that's when we're doing guidance lessons, more targeted to what is that referral, what does that look like and who goes in. It can be a PPS or it can be the clinician, whoever. So we basically encourage everybody, you need to take Bessie groups. That's what we call them, because that's how we put those groups together, whether there is a classroom, a small group, but that's how we are delivering that that services. First, you go to the screening, and then you really are going to do the triage. Sometimes we do observations before we deliver. And then, you know, as a team, we talk about what do we see and what is the best course of interaction. And we have tried to purchase a lot of evidence-based curriculum to address some of those needs.
So have you, I'm sorry, have you, just to follow up, billed for those tier 1 services, and have you seen those claims get approved and been reimbursed for those yet?
It's more of it's not a tier 1, it's a tier.
Oh. Yeah, you're right. It's more of a
it's
you're
a
right.
tier 2 because
true.
it's
That's
targeted and
Yeah,
it's very
it is tier
specific.
2.
So tier 1 would be the curriculum that the teachers use. But if we're going to use
SEL lessons,
there you go. Zones of regulation is not, because now you're teaching the students to identify emotions, to label emotions, and you are teaching them a skill. What coping skill are you going to use when you are feeling red, but you need to go back to sleep? So that wouldn't be. So tier 1 is not billable. Tier 2 and up, yes.
Yes, I'm very familiar with that. So I'm just curious, have you billed for tier 1 services? And that's what I really should have said, but it's very good. But I'm also really interested in the screening and the group and the tier 2. That's great. Thank you for sharing that.
Yeah, we have a counselor that is he does a lot of lesson supports. Teachers reach out to him and say, hey, my students are having a lot of conflict. You need to please provide a peer group. You need to please provide an anxiety group because we can't have it. We need some pro-social skills. So it's very specific for students. So when we only have 2 to 3 students, but the teacher wants the classroom to do it, they'll bill for those particular students, the targeted students. But when you have more than just that 2 or 3, but we have the data conversations and you've developed a plan, this is what they need, then then you can bill for those.
That's great. Great question. Thank you, Heather, for lifting that up. It just makes me think about that the delivery model. And so that's really helpful. All right, Mayu, you have a comment and a question for your colleagues?
Yeah, I know a question that's come up is about the wellness coaches. And so I wanted to see if you can speak to it. And I think for us, like county leads too, what I really taken from Anaheim's like presentations, which I've had a chance to listen to several times, is that like seeing where they are and where they submitted claims, like our LEAs are not at that same place as Anaheim. So you can see all the years of infrastructure building that's happened. Even their embedded provider model, they've been partners with them for for at least a few years. I can't remember how long. So they have a working relationship. So when they start out and they're collecting insurance, I'm sorry speaking, but I want to highlight this because I know it'd be interest from a county level for the insurance. They had their providers call their families, like the clinicians, and that kind of relationship with your CBO comes over years, right? And so I think it's really important as we look at where they're at and where we want to support our LEAs, that for many of them, they're going to have that very beginning of what is their MTSS like framework of like just school-based mental health programming, and kind of going like a little bit more to the beginning to put into these like guardrails and referrals, or even like the folks that are working in silos, like the school counselors are over here under this leadership and the therapists or clinicians are over here in a different leadership. And those leaders don't talk to each other very often, right? So I think as we support our LEAs, it's like even looking at their school-based mental health programming model to get them to that level, which will make the fee schedule more successful. But I wanted to also highlight that wellness coach part.
Yeah. And Mayu, you are correct. We work very close with pupil services. We provide support and supervision for counselors, clinicians, the wellness coaches together, because we want to make sure that the whole system is working together to support the needs of the students. For all wellness coaches It's something new that we started doing it this year because they were approved to start submitting claims in July. We have two different agencies providing wellness coaches. We have Villages of California and we have Western Youth Services. We have a much longer partnership with Western Youth Services than what we have with Villages. However, the providers with Villages, because they provide the clinicians, they were so adept and they are well versed in submitting claims through that health that I am seeing the difference between agencies, and Villages only does preventative. There are only 3 types that they can do the claims. However, our wellness coaches can also do risk and threat assessments with the understanding that that's something that they cannot bill, they cannot submit claims for, but they can certainly do the groups with the students for 30 minutes, individual or in group, but all of that is preventative. So that would be your 0.15 tier, if that makes any sense. Because it's not 0.1, it's like
It's approaching.
between, yes.
That's great. Now, with the 2 different community-based organizations that you're working with, and are they submitting claims to you then to submit and process, or are they going to, I think you were saying, I wasn't clear on who is actually submitting your claims to your third-party vetter. I think there was someone in, right? How does that work?
So we, because we have MOUs and we pay for their contracts, they submit the claims on our behalf. So everybody is submitting through Anaheim Elementary School District. So we are getting the reimbursement. The highest service or code that we got reimbursed for last year was for psychotherapy for 30 minutes.
Okay, great. So they provide the service, they submit the claim through you. You have a vetting service to make sure it's fully soundproof, all the right documentation, medical necessity, and then submitted. That's great.
And for the clinicians, there's like a 2 safeguard, right? Because they submit their claims first through their EHR best notes, and that's clinical, and the clinical supervisors from Villages supervise that. Once that entry is clean, then they are instructed to put it into TAD Health. It's a lot of work because they have to put it into different platforms, but we really appreciate that partnership and that oversight in case of an audit.
That's awesome. I think that inspired Vera with the next question. Vera, you're up. Welcome.
Yeah, I didn't usually get to listen to Anaheim, but I would like to usually. I see their significant building was successful, and then Ted House has been a strong partner for your vendor. So I just want to know because for verify the students' house insurance, and I noticed there's. So some people's the name or something actually is not matching and should get claim decline. And then do you experience that and who's handling that? And from your school district, from the LEA, because you need LEA and the vendor, right? So who is the middle person? How you managing and communicate and then revisit those decline claim?
That's a great question, especially right now. It's us. So I have a biller that works with me with Grant. She helps me. We basically pay additional hours for either secretaries or the clinicians. So our MPA that provides the clinicians, they are the ones that help us to call the parents. TAD Health has also helped us, who is our EHR. They have helped us with verifying information. And Mayu, thank you because you work with the county with CalOptima, and they are willing to support us. But it's a team effort.
Yeah. And a future goal would be to have more site ownership with the school. We have family community engagement liaisons at all the schools have them have more ownership of that conversation and relationship with families so that they can really explain why the information is needed. And they're the face that families see when they bring their kids into school every day. So that's a future goal we're working on.
I see. I'm glad to hear there's a process and there also is a strong vendors supporting.
Well, that's wonderful. So
there's a question if the billers make calls to the families, the providers make calls to the families.
Who's just going to answer? I think we're almost done.
Yes.
I think we are. You guys did amazing. Oh my God, round of applause. Thank you so much.
Did we do well?
Thank you.
Thank you.
Orange County in the house representing. Oh my gosh, amazing. I think we're going to get our song coming out of Anaheim next. Right now, you guys represented large today. Really appreciate all your questions and answers. I think there's going to be a link. I'll go ahead and put it in the chat now if folks would like to get to it. I think it'll also be submitted by um, from Emily as well. But if you go ahead and take a couple minutes to provide some feedback, we really want to kind of get your feedback while it's fresh and try to get a whole level of opportunity to get your feedback in. So if you could, feel free to do that. And then we'll be jumping back into the main group.
Thank you.
If people can be thinking about one high piece they'd like to share out when you come back into the group, people can be able to share that out in the chat or something. So if there's a big takeaway. All right. Well, thank you.
Are we out of time, David?
We are out of time, Heather.
Oh, okay.
But if
I
you
was
want-
just,
Go ahead.
yeah, I was just curious if you've actually been reimbursed yet for a certified wellness coach claim. Yes? Congratulations. That's awesome.
Further follow-up questions. I think that's awesome.
Thank you, David.
Thanks, everyone. You go ahead and use the link and please provide us some feedback.
Okay. Are we done or going back to the meeting?
We'll be in this room for a moment for folks to go ahead and use the link if you can. I think folks might be coming in also, but we'd like folks to be using the link in the chat to provide feedback. If folks would like to share out something that they would like to take from their questions and answers dialogue or their breakout room or some learning from the day, it's a great opportunity for folks to kind of share out. So Yesenia, you have something you'd like to share?
Yes, I just want to say I really enjoyed the documentation session that was led by Patrick, and I have to acknowledge Jen Baker from Shasta County and just what the work that she's doing out there. And hopefully we'll get a work group going to continue that when it comes to, preparing documentation for wellness coaches and school counselors. But it gave me hope, I guess. So I really enjoyed that group. So thank you, Jen. Thank you for the work that you're doing. And again, looking forward to meeting again.
Oh, that's beautiful. Wonderful. Folks have something they'd like to share from their breakout? Feel free to put it in the chat or raise your hand, come off mute. All right, Danielle says, we had a Lindy join us in the breakout for our CWC EXL group and shared about some of the steps that she's taking to assess the existing resources in student services in their county and looking for opportunities for partnerships across departments. This has already led to some enlightening and promising conversations with colleagues. Fabulous. Thank you for sharing. Yes. Wonderful. I know we had in our questions and answers, folks were sharing a lot of great and meaningful questions and answers, some highlighted direct tier one services, how you would bill for that. Great questions. How do you provide the framework for providing county support and looking at a model to replicate across multiple LEAs? Anaheim, thank you so much. Fabulous today.
Well, David, I'll just lift up Lisa's comment in the chat. If any LEAs would be willing to share their MOUs or contracts with embedded and or affiliated partners. And I think she'll also have a post in the online community. And so if folks want to share their resources, that would be great. Or feel free to comment here.
So, thank you, Liz. And thank you, Lisa. Well, wonderful. We'll give you another moment to go ahead and provide your uplift from today's experience. Feel free to go ahead and put it in the chat or raise your hand. All right, I think we're in that place of transitioning into our closure. All right, so we'll try it again. Take two. All right, Karina, hit the slide, please. All righty. So thank you so much for everyone for showing up today with your roses, thorns, and buds. And in closing, we'd like to take a moment to pause, breathe, and honor the joy, the pain, and the growth and humanity of yourself and your loved ones and your colleagues and beyond. So holding that space, feel free to share and or just hold that space for the humanity within all of us. Well, we appreciate all of you in that space. Feel free to add anything into the chat for a closure for yourself. And with that, I'd like to go ahead and really appreciate and thank all of you for showing up today through all the challenges in life that brings, but this community is so beautiful. Thank you, Orange County and Anaheim Elementary, for providing. And may all of you be well today. And thank you so much. Take care, everyone.